Hi everyone, my name is Kylie Coronado and I am an LPN to BSN student at Indiana State University, and this is my Community Health Nursing 444 Health Education program. The population at risk that I want to explore in this health education program is the homeless population that is at risk for the hepatitis B virus. This virus still continues to be an ongoing issue, and this population seems to be the greatest at risk due to immunizations that they are not receiving or that they are not completing for the full doses. Okay, so now I want you to go ahead and pause the video and take a moment to take the pre-test, which is located down in the comments. There should be a link that you can click on and it'll take you to the pre-test. There's 5 questions, and after you're done, continue on with the video. Okay, so the learning objectives that I want to focus on for this education program are: what exactly is hepatitis B? Who is at the greatest risk for hepatitis B? Some of the symptoms of hepatitis B, and why are the homeless at a higher risk for this virus? How can we prevent the infection of hepatitis? And then I wanted to provide some resources at the end for you to learn some more information if you would like. Okay, so what is hepatitis B? Hepatitis B is a liver disease that is caused by the Hep B virus, and it causes damage and inflammation to the liver. There are acute and chronic cases of hepatitis B, and they can be caused by viral infections, bacterial or fungal or parasitic infections. This can also be caused by things such as alcohol, drugs, autoimmune, or metabolic diseases. And then here's a picture of what the hepatitis B virus looks like, and then I also included kind of a staging of what happens to the liver in, the normal, on to what happens when there's like a severe case of hepatitis C in the liver, and then which leads to end-stage liver disease. Okay, so who is at the greatest risk for hepatitis B? So the one group that I wanted to focus on was the homeless population, and within that population, many people are unvaccinated. There are also a very high rate of IV drug users, which then leads to hepatitis B infection, because blood-to-blood contact is the most common, infection and bodily fluids. There's also a higher rate of unprotected sex within this population, which then leads to a greater risk of infection as well. Children who are born to mothers with hepatitis B are also at risk. Those who have traveled to countries that have a high rate of hepatitis B, and then just coming in contact with anybody that has an infection, through a cut or bodily fluids. And, this population, the homeless, their hygiene isn't the greatest. They're in close contact with one another sometimes in the shelters or on the streets or where they're living. So I think that's why I wanted to focus mostly on this population, because of the risk that they have. So what are some of the symptoms of hepatitis B? So some symptoms include fever, fatigue, loss of appetite, nauseous vomiting, abdominal pain, hives, dark-colored urine, clay-colored stools, joint pain, and jaundice. And according to the CDC, the hepatitis B symptoms will show up about 90 days after you've been exposed. So there is an incubation period. So if you've shared, a needle with somebody in a drug contact situation or had unprotected sex, like many of that homeless population do, that I wanted to focus on, they may not have it until 3 months after they were exposed. So then in that time frame, they're not sick and showing symptoms. So then they go on to infect other people, and that's how this virus just kind of spirals and gets out of control. So if you have been infected with hepatitis B and you have, so say you have a patient or someone that has hepatitis B and you've come in contact in a way that it can be transmitted to you, you should get tested early and take all the proper steps to protect yourself if you've been exposed. That early detection can be what saves your liver in the long-term development of hepatitis C. The hepatitis B immunoglobulin is what is given right away if the exposure has occurred, and preferably this should be given within 24 hours. So why is the homeless population at the highest risk? Well, in the homeless population, like I said before, there's a higher rate of IV drug use and unprotected sex. Their knowledge of the risks associated with the hepatitis B infection is also much lower among this population. So they might share needles with one another and have no idea what they're doing, or they might just not care. This population is also more likely to be unvaccinated against hepatitis B, which is why they, have a higher risk of catching the disease and then spreading it to others. In a journal article that I found of health promotion and maintenance, they did a survey of 534 homeless adults in downtown LA, and they revealed that the hepatitis B virus was 7 to 10 times higher than the U.S. general population. So their population was much higher than, the normal population out there who's been vaccinated and working and, vaccinating themselves and their children. So it's quite interesting, and this journal article is included at the end in the references, and it's actually a great read, and I enjoyed reading it, so I suggest that others do the same if you want to get some more information. The homeless population also face things such as social, behavioral, and environmental factors that increase their risk for hepatitis B. Only half of the homeless population is even screened for hepatitis B virus, and then their use of opioid dependence puts the population at a greater risk as well, because many of these patients in this population, get hooked on pain medication, and then when doctors stop prescribing, they turn to things like heroin, which they need to inject, and then the sharing of needles becomes higher. They just need to get that fixed, so then, here they are sharing and doing drugs with one another and just spreading a virus throughout. So preventing hepatitis B, some of the things to do are vaccination, don't use IV drugs, practice safe sex, wear gloves when you're cleaning up bodily fluids, get screened, environment safety, cover cuts and wounds that you have, and take prescription drugs as prescribed. This will not lead to addiction and later IV drug use when narcotics are no longer available. When is hepatitis B usually given? This is usually given in 2, 3, or 4 shots. The first dose is given right at birth, the second dose 1 month after the first, and the third dose is given 4 months after the first shot. An infant should be a minimum of 24 weeks old at the time they get that third shot. If, for instance, you were not vaccinated as a child, you can still get vaccinated against hepatitis B as an adult. The FDA approved a 2-dose hepatitis B vaccine for adults in 2017. So the first dose is given, and then 1 month later, the second dose is given. So say your parents didn't vaccinate you and you're an adult and you want to maybe go back to school and go to college, and they require you to have your shots, or even a job that requires you to be up to date on vaccinations, especially a job in healthcare. There's no worry. You can still definitely get vaccinated thanks to the FDA approving those 2-dose shots for adults in 2017. There are drugs that treat hepatitis B. There are interferon-type drugs that help boost the immune system and help the body get rid of the hepatitis B virus. This drug is administered through a shot over a 6 to 12-month period. There are then antiviral drugs, and these drugs help stop or slow the hepatitis B virus from multiplying within the body, and this will help reduce the inflammation that is sustained by your liver. These drugs are taken as a pill once a day for a minimum of 12 months. Okay, and here are some resources that I included, and they were some great sites that I referenced throughout my video. So there's the journal article that I talked about, and then there's some other there's a CDC website that talks about hepatitis B, and it's a great, easy one to navigate and explains to you what the virus is, how to prevent, the steps to take. But these are some great resources that I really enjoyed reading if you want to check them out. And here are my references that I used. Some of them have my resources as well. And that's the end of my video. If you want to click the link below, you can take the post test after watching all the information. And thanks again for watching.